So the Swedish government decided a couple of years ago that life science is a strategically important area for this country. And since then, a number of different initiatives has been launched. And we'll now get an update on how this work is proceeding. So I will say welcome to Jenny Nordborg, who is National Coordinator of Life Sciences at the Government Office and Head of Health at Vinnova as well. Welcome.
Thank you very much. What an interesting morning. Such a challenge to come after this and talk about policy development. So you know that this is challenging, so you have to bear with me and support me during these 20 minutes. My role as National Life Science Coordinator is for the government offices. I also work for the government offices in my role as Head of Health and Life Sciences at Vinnova. I have been doing so for many years. And when I got the opportunity, I couldn't miss it to also work with the coordination. I have been funding so many interesting projects, collaborations in the whole field of health and life sciences. I have seen some that could really be, and some that have been really huge successes. But I've seen also so many things that were not implemented, did not scale to in the speed that are really necessary for the future to come. So that's why I really been taking this kamikaze job, also within the government. So the Office for Life Science is an innovation, like the Office for Life Sciences in the UK. It's within government cross ministries. So I work for all the three ministers, and Ibrahim Baylan just changed his English title after I submitted this slide. It's now Minister of Business, Industry and Innovation, so just so you know. And then it's Matilda Ernkrans, Minister of Research and Higher Education, and Lena Hallengren, Minister of Health and Social Affairs. And they really have a strong reinforcement that life science is important for the government. They have a very good knowledge, and you have all contributed to that in such a good way during the past 5 years in a political awareness of how important this industry is for Sweden and how it all goes together. You can't separate healthcare from business and from research in this field. They got that. And that's thanks to you. So really be happy with that. And the task and the mandate for the Office for Life Science is to coordinate the work within the government, within the government offices, to develop a national strategy, new plan for life sciences for Sweden, and from that then, as a stepping point, work more with the coordination within life sciences within Sweden, of course, but also within the Nordics and internationally. And with the Nordics, we also talk about Estonia and the countries around. So. If I go back really to my title, I think that it has never been more interesting to work within life sciences for all types of professions, not just for medical research and for business side, but also from the ethical perspective, from the societal challenges as a whole, because there are so many policy issues that are really piling up in this field. And we have to work with this. This is also where there's a lot of profound understanding and a sense of urgency that policy development and framework conditions are needed for this sector to progress in a good way, because it's progressing anyway. And that is the challenge, of course, from the policy developing side, to keep up with the pace. First to understand, then keep up with the pace in a good pace, not too fast pace, but not too slow pace. The examples that I want to look into are just examples. There are many other very good examples. But a prerequisite, of course, and as we have been talking about during these 2 days, is that a prerequisite for precision medicine is data, the use of data, the sustainable use of data as a whole. And what are the policy dilemmas here in Sweden? That's the really funny rhetoric question that we have. We all are very aware of what the policy dilemmas are. We have the both the capabilities to work. We have the assets of the longitudinal data pool. Our PKU biobank since 1973. We have all inhabitants born in Sweden, we should say, listed in these type of biobanks. If we build a sustainable, secure infrastructure on that, we could really leverage from that. But we don't have the mode of action or plan of action for that. That's the dilemma so far. We also need to, and one thing that we often pride ourselves and should pride ourselves is really the ability to start. If we look on a global scale, we at least, you talked about prostate cancer and AI yesterday, I know, really to start implementing this actually in within healthcare, in that we already testing, that we already utilizing, that we already doing. That's a good part from Sweden. The challenging part is that we are doing that within our area of jurisdiction, which is then within the area of the region that can't even utilize the whole data across the region. But I think that this and what we have seen for the last 5-6 years are very many policy reviews, investigations that have been piling up, and there's now a mode for actions in many of these. Then, so that's really. I think that we all agree in that we see a lot of now starting the use of intelligent decision support making within healthcare. We also need to look across sectors, and that's also an ability that we have in Sweden, where I think that the different type of investments that we're now seeing from that are really truly public-private partnerships from business, from the regional governmental authorities, from the government itself, and from healthcare, that join forces together to see how can we work with data sources, new modes of really working with advancement of data usage cross-sector. And the first initiative of AI innovation of Sweden opened up in Lindholmen, where of course we have the automatic transports together with life science in that sector. A strong commitment from all of these actors to do a lot together. The healthcare or life science data that will go into this work is the data from the SCAPIS study, one of the really large studies that we have on the pre-screening of heart failure in Sweden. One of the policy challenges that we're facing then is how can we store that data in one physical place in Sweden as a whole. And what I think that is so good now, because it becomes so clear what are really the policy actions that we need to take a look at and decide on to do changes or not to do changes. But it's not still, we can't claim still that we can't claim anymore that we don't know what the policy challenges are, and we don't know where the regulations don't work anymore. I think that we now have much more knowledge on that. So for that, of course, has a lot to do with the type of infrastructure that we can start building in Sweden for the future. Another type of infrastructure that we are setting up is for precision diagnostics. And I think that this is a really interesting initiative in Sweden, with the Genomic Medicine Sweden, where all the university hospital regions come together and co-fund together with the government a nationwide infrastructure on how we should work with these with the genomic diagnostics in a sustainable way. And what is really the key here? The key is that we're doing it in the same way all throughout Sweden. We are hoping for that precision medicine will lead the way to more equality, to be a more of a precise way of working that will be available for all. But we are all very aware of the challenges in actually making that happen. And so from the government side, it's really essential to start building these infrastructures as a whole. With this work, the previous work, it also boils down a lot to, and we talked about that yesterday, when it comes to data storage, when it comes to security, when it comes to, as you pointed out, Cecilia, the national security. And I think that from many countries that we don't see so much, haven't seen so much in Sweden, this is a personal reflection, that we're starting to see now. I think that when you go to Asia, Japan, for example, they see health as that's really a security concern for the defense. The defense area as a whole work a lot with the health data. We're starting to see that awareness much more in Sweden, because you have to look at that in a totally holistic way. If we would to work with policy development in that holistic way within the government offices now, I don't think that we would progress maybe so much. So we have to sort of stick to the sphere of these three ministries to start with. But what I think that is really driving the development in this area as a whole, globally. 23andMe, as you said, it's really patients, advocates, people that are very knowledgeable about their disease, about their welfare, about their mode of actions, that we need to use more also in the policy development area. And that's of course a big discussion on how we could really utilize the co-creation ability that we have in Sweden. And I think that when we meet from the government side and from the Vinnova side with many of the global corporations, this is one of the really the strongholds of Sweden that are pointed out, that we also have the ability to use the mode of action and collaboration with the patient and the users on that side. But with that, of course, we have to meet the speed and expectations that are coming from the driving forces of the whole society. And I think that is also one way where we have to work with the policy development, maybe more, and also regulation, more in a process way type, more than stepwise. Because what's for a welfare system in Sweden, of course, the precision era is extremely challenging. And you touched upon that in the morning. If we don't provide this in an equal, secure environment for the Swedish people, the 50% who can pay for this, they will pay for this elsewhere. They will get the treatment. They will get for the healthcare. They will not have the willingness to pay for the welfare system as a whole. So this is not a small issue. This is really a big challenge to be able to keep up with these trends. And I think that it's fantastic that we have a movement of patients and that perspective in Sweden that even puts out new words that become common to everybody. So the government is, of course, working on many policy development areas as a whole, and everything has to do with everything. The new review and investigation of the pricing of pharmaceuticals has a lot to do with the policy development of advanced therapies and precision medicine. So that's one example of where, of course, the government is working right now. Another way of working is also through policy labs, to be able to test and develop policy in many fields of areas. And in my Vinnova role, I've had that task for a few years, and we have made policy labs in very many different sectors. And I think that this type of an environment is also a type of policy lab when people from different areas come together and really discuss where are the hurdles. This committee, the Committee for Technology, Innovation and Ethics, their mandate from the government is really to pinpoint where are the policy challenges that we're working on right now in 3 specific areas where we could both need to change legislation, but also to see where, how wide are the framework conditions already, how can the framework conditions already be used. And the areas that have been prioritized are precision medicine, connected industry, and autonomous vehicles. And I think that it's interesting that we have this holistic perspective on that, but the solutions and the challenges across these 3 areas will very much be the same. I also think that the setting for the committee is very interesting in a quite non-typical Swedish way. I don't know if you have pinpointed that already. Of course, we have the Director Generals it's from the Final Supervision Authority together with the Competition Authority, the Director Generals. My former Director General from Vinnova, Charlotte Brogen, is now the industry representative. We have from the Supreme Court, we have from the ethical and medical side from the Karolinska Institute, but we also have the Archbishop in the very secular country of Sweden. This is not a common way of setting. She's very good in technology and policy development ethics as a whole, but I think that this is an interesting way and setting of looking at it. One of the in precision medicine, one of the they have selected to work with the broadening of consent issue as a whole, because that's something that we need to work with in a more agile way in Sweden, as we know. We know that we almost have a lockdown of a system due to that we don't have an interactive system for consent as a whole. We don't really know how we should set the boundaries. I don't know if it was here. I wasn't here last year, but I was here 2 years ago, and if it was in this conference where there was presented a study on consent. Was that here or was that in sort of that area? And I thought that was so funny, and I know how I would have answered to that study. I don't know. It could have been from Linköping or some of the other studies. And I mean, so many respondents answered to this consent, and it also said you should give up your firstborn child in the consent. And just to couple back with the first discussion, we know that we don't, and this was really tested in an academic environment. So we know that people from all sectors, we don't read the consent papers. We know that we have to work with consent and broaden consent in a new and agile way. So that's one of the areas that they have been really that they have chosen to start with together with the government. So So that was really precision medicine, narrowing it down to one of the policy aspects. The other policy aspect is this: how can we work with the sustainability issues on an ethical side much more in life science business as a whole? I think the industry is really a forerunner on this, but we don't have a holistic common plan for the sustainability in all three aspects within healthcare. We talk about the of course, the economical sustainability. We talk about the health and society sustainability. But I don't know if you agree with me, but I too seldom talk about that we have to keep also within the planetary boundaries, also within this sector. So I look forward to much more of a holistic policy discussion also here within healthcare and life science. And I think that the CO2 pollution from healthcare is as large as it is from the aeronautics, the flight business as a whole, just because this sector is so large. But it cannot, for a sustainable environment globally, the healthcare and life science needs to be a forerunner in this area. So how do we do this? We really need to work with systems innovation in a much both broader set, but in a more agile way. The OECD have been looking at it, the UN have been looking at it, and I'm really looking forward to see the next step of the European Commission's work with the missions, where we set a broad target on a mission, working that forward. And Vinnova has also started to look at our work. How do we move from funding several very good initiatives to have a more of a mission-oriented approach together with the stakeholders that we might not include in this area already. And for that, we need to be, of course, as Commissioner Moedas says, we need to be ambitious about this if we are going to reach the targets. So looking ahead, when we are working with the policy development, we have to balance that it's really long-term and still to find an agile process of really moving ahead. We have to this says common goals. To set the common goal, but the common goal can't still be precision medicine. We need to move towards precision health. And I know that there's still an economical challenge for that. Preventive health does not really care for the healthcare costs in the end of the life anyway. But that's really the shift that we have to be moving towards. Not just the physical health, I think that we talk about that, but in precision medicine and in the genetic side, we're not talking so much about the mental health issues. And we need to do so in really maintaining the trust and equality for the whole society. To finish up, the Office for Life Science has had a hundreds dialogue with 100 different actors from the sector. We got really good input to the upcoming strategy. The strategy will be presented this autumn. It will be a framework strategy that really speaks about both the opportunities and challenges that we have in setting a long-term goal. So that is for to be able to have a really long-term view on the work. This will, to also be able to have an agile approach, this will come also with continuous measures over the years. And of course, the precision view of healthcare and life sciences will be, as a whole, an overview of this whole work. With that, thank you very much.
One thing that is obvious when we listen to the different speakers and also to yourself is that a lot of things is going on. We will need some kind of new regulations and so on. You live your life in the governmental space, where I imagine things don't always move so quickly. So how do you address this? That the different paces that goes on between technology and governmental policy development?
I think that is the whole key with the Office for Life Sciences. That does not speed up anything to start with, but without that type of bridge, we won't find the agility and the speed that we need to find. But of course, as you know, this should have been done in half the pace. We're definitely not there yet. But I also think, and that's really something that I see a changing point. I hear that a lot from many actors. We have all the reviews, investigations. We have a lot of knowledge base on that. I think that there's time for maneuver, but I always think, I thought that 10 years ago too. So, and I will think that 10 years from now.
Okay. So you have 3 different ministries as in your steering group: enterprise, education, and healthcare, or social enterprise. What differences can you see in their expectations of life science?
That's one of the results that I'm really proud of over what we've done over the last year, is that there's a common view that life science is about all these 3 things. That's a good starting point. You have to take your wins there. Then, of course, it's still, the business side is still business side on their actions. The healthcare side is healthcare on their actions, all building from the research and education. And the parliamentary situation that we have now is not easy for them to work through, of course. Well, that's a non-answer.
No,
skip the question.
No, but it gave a quite clear view of your daily challenges. And we are very happy to say welcome to Erik Forsberg, who on a very short notice managed to come here. And you will tell us a lot about, is it the largest or one of the largest networks for future health in Europe, EIT Health?
Since I have a scientific background, I always try to be a little careful. So I say probably the largest.
Probably. Okay. Welcome anyhow.
Thank you. Thank you. So I was asked on short notice to step up. I cannot talk for the European Commission, but I can talk for European Institute of Innovation and Technology. I also answered that I can maybe not cover the kind of the whole subject for this session, but at least the latter part of this session was how do we prepare for the future? And I think one way of preparing is we know that many of the answers of societal changes will be solved by different kind of public-private partnerships and networks, and often those are very informal between garages and so on, and sometimes they can be also more structured. And the European Institute of Innovation and Technology is a latter part. I could also say that if you want to know more about me, I am sharing some genetic information with a Houston-based company called Family Tree and DNA. That's a company that most Swedes tend to use if you just are curious about some ancestors and so on. So I choose that one just for that purpose. And my father is my father, so that's good. Okay, so EIT is part of Horizon 2020. It has some of the budget, not the large part, but 2.4 billion euros is allocated to EIT. If we then step further, and please, I know that I think in the EIT European network, I quickly counted that 9 of the organizations who are partners in EIT are in this room, and many of you have been longer here than me, because I started in March, so it's day 70 for me, so if I say something wrong, please correct me. But some kind of inspiration was from the kind of ecosystem that is present in Boston, Cambridge, around MIT. When that inspiration that should be transferred to Europe, it was found that it could be difficult to kind of set up an environment somewhere in Europe and get a decision upon that. So the solution was to set up something called not an artificial organization, but a virtual institute organization, which is EIT. So if we then, what have EIT then done? And the answer is, and many of you know that they launched different kind of knowledge and innovation communities, the KICs, and many of you have heard about the KICs and taking part in different KICs and so on. There were 6 KICs. Today there are 2 more, so at the moment there are 8 KICs running. I think half of them are quite active in Sweden. They have a budget of about 1 billion euro per KIC as an internal budget, and then of course attracting other kind of budgets from different sources. So EIT Health is one of these KICs, and if I go back then, I think it was founded, it was maybe approved 2014, started 2015, and then have been in an acceleration phase, and is still in an acceleration phase budget-wise. So the budget for this year is 86 million euros, and it's expected to continue to a plateau which will be reached in a couple of years. Okay, this is a few words about the strategy, and those of you who are used to kind of working in the national strategic innovation program or cluster development organizations in Sweden can recognize some of the kind of challenges and outcomes. And often it comes, what we would like to achieve are kind of 2 parts. One is connected very closely to healthcare, better health, sustainable healthcare system, and then there is often then a growth component of the private sector as well. And this is it's the same in EIT Health. Just to talk about governance, without being too administrative, it's not very easy to kind of govern a pan-European gigantic network. So we have to have some kind of, things in order, of course. So the European Institute have the head office in Budapest. The KICs established themselves kind of independent legal entities. So EIT Health have a legal entity then, not connected, but just have agreement then with EIT Health centrally. Headquarter in Munich. So I was in Munich this Wednesday, working with EIT Health centrally. And then we have also kind of local offices all around Europe. Then I'm responsible for Scandinavia, which is one of them. We have 7 local or regional offices. So we have Barcelona covering Spain mainly. We have Paris covering mainly France. We have UK, Ireland in London. Rotterdam is running the Benelux. Mannheim is running Germany, going over to Switzerland, Austria. And then we have the Eurostars in like a banana around Europe with an office in Budapest. In Scandinavia, we are running the operation as an ideell förening. I don't know, it's a non-profit association. And I talked to, that's it. And I mean, this is a common thing. So I'm the managing director over a team. There is a Scandinavian board. We have 2 board members in the room. And there is also then the annual general meeting. And we actually have next annual general meeting at RISE next Wednesday for EIT Health Scandinavia. I am then also, as managing director, one of the members of the European Management Board, where all the managing directors, together with the CEO centrally, COO, and some other individuals, make many of the decisions. But we have to keep order. So a couple of persons from the Scandinavian board are also members of a supervisory board, who is overall responsible. And Jon-Olof Höge is one of the members in the supervisory board. So this is how it's running. I think it's very interesting, actually, because we are kind of a little bit like a public funding agency, but the real importance is building the network. And the EIT have around 100 employees today. 40 or so centrally in Munich, and then a number of small staff in all parts of Europe then. And it has grown, and I think it will not grow very much now, but we are like a startup organization also, because we have to organize HR and all these kind of things. So it's combining being part of building up something pan-European and at the same time being an agency for some matters. So it's very interesting. And the goal is then to work together for healthy lives in Europe. How do we do that? Yeah, this is not a very difficult task to think about, that we work in different ways to identify unmet needs. And then the next thing is then to try to bring programs forward which could solve such needs then. And I mean, one way of doing it is to run think tanks and so on. And I know that some people in this room were in a think tank at Karolinska Institutet in August last year. And it was a think tank, Big Data and Health. And there was also one outcome of that is transferring to my organization, that we are working further with a smaller strategic activity around biobanks and registers, which is an asset in Scandinavia, which we also have heard about. These are the focus areas today. It's changing a little bit somehow. We open calls all over Europe. We can't open for any kind of area within life science and health, because we would get thousands of applications and so on, and we don't have the machinery to cope with that yet. So we have focus areas, but I have asked my colleagues, since I'm quite new now, how often is it that some applications don't really fit in? And I mean, most often applications, projects fit in and so on, but we want to have focus areas. And these are the 6 today that might be adjusted and so. So I go back to the network for those of you who remember pictures and so on. And so the green dots are the 7 regional organizations I talked about in Europe then, headquarter Munich, and the blue ones are the offices for the InnoStars. And we work together in the governance structure that I described then. We have around 140 partners in the network. We could grow that, but there is kind of a strategy here too, how to build the network. So we are not like diluting with thousands of actors, but we have a strategy for what kind of partners are required. Cities, healthcare payers, healthcare providers, universities, large industry, startups, and so on. I also want to emphasize that these are the 140 core or associate partners. But apart from that, any startup basically in Europe can take part as long as you have some formalized connections with any of those partners in Europe. So it's kind of, there is a partner club, but then it's an open network. What does it mean in practice? It means that we, of course, fund and support a lot of companies, research programs, and so on. I will just click through a few of them. And of course, we have divided the activities basically according to the knowledge triangle in different programs. Education programs, create, that's business creation, business development. The accelerator part is more like the business incubator part. The create part is more like the open calls for projects, innovation projects. And many of you work a lot with technology readiness levels and so on to try to understand where we are. And you can find more information on our webpage. But it's not basic research. It's not on the market. It's in this space in between, of course. I couldn't avoid, as one example, to mention what Henrik described so nice yesterday, Stockholm 3. So this is a very good example of a fantastic project who also reaches patients. There are also Fellowships networks, this is actually in the campus part, the education part, and many of you in this room also know the clinical fellowships, which started from Stanford, one of the Stanford programs, and have been spread through Europe as clinical fellows. And this is now run by EIT Health in many places of Europe. And it's actually the largest consortium now with 19 partners all over Europe, including several in Sweden, where we have representatives in the room. There are a number of outreach activities. Citizens are part also of EIT Health. I also come back to when we had the think tank in Stockholm last year. It was concluded, the think tank on big data and health, that we claim we have these fantastic assets of biobanks registers in Scandinavia, Sweden, Estonia, Denmark. We have kind of analysis that maybe the partners in the European network, not least the industry, could collaborate with the biobanks, individual ones, national ones in the countries in the Nordics, even more active. So therefore we have one strategic activity now, not to do anything which local national biobanks and your organizations do, but at least analyze and try to understand, is there a possibility to be even more attractive for the whole European, not the least industry network, when it comes to use of biobanks and registers. So that's one strategic activity we have. I won't go much further into this. I think when it comes to startups, there are a lot of programs, and I think that's also why for you and many people I've heard can be a little hard to grasp what EIT Health do and don't do, because there are a lot of programs launched through Europe. For example, for startups, there are kind of initiatives for both, seed funding, Series A, B, C, crowdfunding platform, investors network. There are discussions with the European Investment Fund on Series B, C, at least to investigate what we can do together in Europe. And when I say to do together in Europe, I would also like to emphasize that we as EIT Health Scandinavia can also drive Scandinavian strategic activities in order to help Europe, so to say. So what do I have more? This is just some graph. It's not updated, but I mean, it's growing. This is number of startups supported through one of the three programs, the Accelerator program, and I know that we are over 500 companies supported so far by different means in different programs right now. I also know that usually when we go out in with some money, usually there is, for example, one program called Head Start. You can get 50,000 euro. Then if you then look what happened 1-2 years after, usually they have attracted at least 10 times money from other investors and so on. So that we are one facilitator. EIT Health, compared to other KICs, seems to be, I learned just a few days ago, quite successful, at least when the kind of EIT awards for all the KICs are given out. And I think this was last year. 3 of the 5 EIT awards were granted to EIT Health projects. So I think we are doing well in an EIT perspective. So I think that's it. I know most people say it's hard to understand, so I hope you got some more information.
Thank you, Erik. So there are politicians somewhere in the background here who has at least decided on Horizon 2020 and the funding. How's the feedback loop going? Do you feedback? I mean, obviously you have a lot of in your network, a lot of knowledge projects going on. So is there any feedback going back to the politicians that, okay, now this is happening, you probably need to?
I'm sure there is a lot going on, and I mean, Jan-Olof, who is in the supervisory board, more close connected to EIT, for example, knows. I mean, many of our partners have a lot of feedback loops. If I go down to the floor where I am as managing director, then we have strategic boards with members from Scandinavia in each for the business creation, for innovation, for campus education activities. and that's very important to have Scandinavian representatives to feed back to headquarters in Munich, and I'm sure it's going up as well. I'm 70 days in office, so I don't know if, Jan-Olof, if you want to comment more, but sure. And I would like to have the Scandinavian organization more active, integrated into our ecosystem, and also use EIT Health as a, from my perspective also to give a lot of feedback. I'm at least in the management board in Europe where we can decide what to do and what not to do. And we can never reach a situation where if we pump out 50 programs from headquarters, I'm sure that maybe 35 will be very suitable for Scandinavia. 15, maybe 10 will not be very valuable, and maybe some of them might be even, competing or so. And my goal is, of course, to feed back as much as possible from Scandinavia.
So now you've been just 2 months here at this position, but you have previously worked as head of one of the incubators, or what would you say?
Like cluster organizations.
Cluster organizations, in Sweden, and so you're used to this kind of support, innovation support offices and systems. How would you say? At which level should this be done? Is it local? Is it national? Is it European? What are the... I
guess it's all of them. I have been quite engaged with others here in the room to work as much as possible on national level too, since Sweden is a small country. But I mean, we can never... It is perfect that regional initiatives are kind of created and so on. That will happen, and it should happen. But of course, I think we need a lot of national initiatives as well to try to connect.
But can you see certain areas that are better suited on the European level and then some more local, or could we get some? Or should everyone do everything?
No, of course not. Of course not. When it comes to healthcare, I guess we could have a long discussions also about 21 organizations and then one country, and how to try to do things together, to implement things faster in different parts of this country. There are many people in the room who would agree, I think. But then having the European arm, I mean, life science, not the least the industries, is in a global, international industry. Sales is mostly outside of our country, and if we at least can connect where we need it, to Europe. And EIT also establish offices now globally. And EIT Health also, we have a number of in pilot phase now decisions where to try to establish links in the world. So all three is answer. Boring answer.
Oh, yeah. Then we will say thank you so much for coming here, and well done on short notice.